Impact of type 2 diabetes on surgical outcomes in patients with arterial disease is an investigation conducted by Dr. Dion Haliti from University of Pristina, Faculty of Medicine, Pristina, Kosovo. In this presentation, we will explore the significant impact of type 2 diabetes on the surgical outcomes of patients with arterial disease. We'll focus on how diabetes affects vascular surgery outcomes and discuss strategies to improve clinical management. Type 2 diabetes plays a crucial role in the development and progression of arterial disease. This study focuses on how T2DM influences the outcomes of vascular surgery, aiming to improve clinical strategies and reduce postoperative complications. We conducted a retrospective analysis on diabetic patients who underwent vascular surgery. Patient data was collected from medical records, and statistical methods were used to analyze outcomes, helping us understand how T2DM affects surgical results. Most of the patients in our study were elderly, with the majority falling between 68 and 81 years old. A large proportion of these patients were male, and nearly 90% were on insulin therapy, which highlights the severity of diabetes in this group. The most common surgical intervention was amputation due to ischemic gangrene, which accounted for nearly 16% of cases. Arterial thrombosis was the most frequent issue faced by patients before surgery, affecting over 23% of the cases. Post-surgery, most patients stayed in the hospital for about 7 to 11 days. Additionally, a majority of patients received combination therapy, including antiplatelet agents, anti-diabetic drugs, and antibiotics, which contributed to managing their conditions. Our findings emphasize the increased risks that diabetes poses in managing arterial disease, particularly in surgical settings. Personalized treatment strategies and interdisciplinary care are essential to improving outcomes and minimizing complications for these patients. In conclusion, type 2 diabetes has a profound impact on the surgical outcomes of patients with arterial disease. Personalized treatment, patient education, and interdisciplinary care are key to improving clinical outcomes and minimizing complications. Thank you for your attention.